there's several risk factors that can increase the risk for gynecologic cancers. And so for patients, for example, with endometrial cancer, patients who, as they age, are at higher risk, patients who have had polycystic ovarian syndrome or prolonged estrogen exposure can be at risk. And the prolonged estrogen exposure can come from a couple of risk factors. It can come from having extra estrogen in the body. That can be either from taking estrogen or actually from weight. In both females and males, when we have increased weight in our bodies, it leads to there being extra estrogen, and that can also stimulate the production of endometrial abnormalities and cancer. In the United States, also Black women are at higher risk of endometrial cancer. There's some burgeoning data also that hair straighteners can be a risk factor for endometrial cancer. In addition, a family history of uterine or colon cancer may identify a hereditary syndrome that's associated with hereditary cancer. Can include endometrial cancer. And certainly from the point of view of ways to get evaluated for endometrial cancer is that if you're having certainly bleeding after the menopause, that is never something that is normal. It should always be evaluated by a doctor. But before menopause, if you're having bleeding that is heavier than what's typical for you, or a period that's not stopping, or starting to have more pain with periods than before, it's always important to see a doctor and make sure that there's an evaluation for the lining of the uterus as part of that evaluation. For ovarian cancer, patients that have the new and frequent onset of bloating, feeling like they're having urinary changes or abdominal pain, those are absolutely symptoms for which they should contact either their primary care doctor or their gynecologist. And I think just making sure that you pay attention to your body in terms of when these symptoms started, how different they are than your norm, how long have they been going on for, and also thinking about has anything else changed in your body that you want to make sure you share with your doctor.